When it comes to your skin, call in the specialists. For a trusted, non-surgical solution to youthful skin, there is simply no better choice than Skin Renewal. Our clinics specialize in the full range of medical aesthetic treatments, using a wide range of medical-grade technology. Let our dream team of highly specialized doctors show you how to become the best version of yourself. Skin Renewal, the elixir of you.
Welcome back to A New You Season 2. I'm Corinne and today Lianca and myself are discussing anti-aging treatments with Dr. Kate at Skin Renewal. Less is more when it comes to aesthetic treatments, I always say personally. Aging gracefully is key. Let's see what Dr. Kate has to say and what we're going to be doing with Lianca today. Hello, Dr. Kate.
Hi.
Are we excited? I mean, Lianca's super excited. She's looking beautiful, enjoying all her treatments with you at Skin Renewal. So thank you for looking after her skin so beautifully. So tell us a little bit about anti-aging. I think, you know, when you reach a certain age, that's a huge element for women and for gents these days, you know, because men are into aesthetics as much as ladies are. So tell us a little bit more about anti-aging.
What happens when someone ages is that it affects your bone, your fat pads, and your skin. Okay, so your bone density starts to decrease. Okay, and then the fat that sits on top of your bone, it basically starts to deflate, and because it's got no support from the bone, it drops. Okay, so that's why you see ladies who are older, they start to get that sagging. They start to develop folds, they get sagging, and then also you have decrease in your collagen, you get fine lines and wrinkles, your hyaluronic acid, you lose volume, and then your skin's elasticity, elastin, so you get crepiness.
Okay.
So that happens to anyone, no matter if you're male or female. It happens to everyone.
Yes.
Yeah.
Okay, so what is your plan with Lianca? Because she is still youthful. So what is your ideas with her with the anti-aging?
Okay, so Lianca is still quite young. She's in her mid-30s. So everything we'll be doing is preventative. Okay, so we're going to do a little bit of Botox, some fillers. Yeah,
Fantastic.
Very excited.
So do you feel it's better to start looking after basically injecting and using fillers and Botox in your younger years, like your 20s or 30s, rather than when you in your 50s or late 40s? What do you suggest is best?
So it is better to start when you're younger. So it's better to prevent than to correct. If you start in your 30s, you need a little bit of Botox, some fillers. But if you only start in your 50s, there's a whole lot that we need to be doing. A lot more Botox, a lot more fillers, more treatments.
And with regards to Lianca, you know, she is still, as we said, you know, she's still youthful, and I look at her and I just think she looks beautiful. You know, there's not, I don't think, too much work to be done, but in your opinion, what are we going to do with Lianca?
So for Lianca, so what we do is we do something called MD codes. And with MD codes, we first address the foundation of the face. Okay, and this is done with fillers. Okay, and fillers are made up of something called hyaluronic acid, and they give you a little bit of plump, and they also lift. So with Lianca, what we do is we put a little bit of filler into her cheeks here, and we create like a lifting effect.
Okay.
And then we just put a little bit of filler here, and that would help with this hollow that's starting to form. And then also it would help reduce that appearance of that dark under eye circle. Okay. And then just into these folds, I mean, usually when I see patients, that's the first thing they complain of, is this nasolabial fold. And that's just this like cheek fat pad descending over your ligament. So what we would do is just put a little bit of filler in there, and we'd try to soften it. Okay, but it's nothing drastic. It's not going to give you like, it's very subtle, it's graceful. And then when if she was older, we'd put a little bit of filler maybe into her jawline, into her chin. But for now, we'll just focus on the foundation of her face, so her cheeks or mid-face.
Okay,
Yeah.
and what just generally is the difference between Botox and filler?
Okay, so filler, we treating static lines, so lines that have been there, or expression lines that have been there for a while. So usually these lines we get from laughing, smiling, but Botox we use to treat dynamic lines, so from expressions that you're doing all the time, so like your frown, forehead, around your eyes. So namely, we mainly do Botox on the upper part of the face and fillers on the lower part of the face. There are exceptions, but that's usually what we do. Yes.
And are there other anti-aging treatments besides injectables?
Yes. So we have a wide variety of treatments at Skin Renewal to stimulate collagen. I've mentioned a lot of them in the previous episode. So we do chemical peels, microneedling, we do lasers. We have also it's a fantastic laser, but it's very effective and quite intense, called Fraxel. So especially if you've got advanced aging and pigmentation, you can do a vampire facial.
So what exactly is, I've heard of this vampire facial, but how does it actually work?
So what happens is we take the patient's blood and then we spin it down in what we call a centrifuge, and then we get all these lovely growth factors, more than you'd find in any serum that we use in our treatments or over the counter, and we actually needle that into the patient's face, or we inject it into the patient's face, and it stimulates collagen. Yeah, it's an amazing treatment.
Gee, that's incredible. And with Botox and fillers and anything you're injecting, I mean, what are there must be dangers. You hear a lot of things like, people are nervous to have this, but what would you advise our viewers?
Well, when you're putting a needle into anyone's face, there is a danger, but you are with an experienced injector. We take precautions when we're injecting, so we use something called a cannula, which is a blunt needle, to move around your blood vessels. We also take a thorough history so we can determine if there's any contraindications to the procedure beforehand. So we try to minimize the risk as much as we can, yes.
And downtime again with Botox and fillers? I suppose there is some bruising.
Yeah,
naturally.
Just a little bit of redness, swelling in the area you've injected, and then some bruising. Yeah, so depending on how long the patient takes to heal.
And with Botox, you don't see the results immediately. Is that correct?
Yes, so with Botox and fillers, you don't see the results immediately, so it takes about 2 weeks to get your final results.
So at Skin Renewal, you do things very beautifully, naturally, because I think that's, as I said, what's wonderful is aging gracefully. So can people tell, generally, if you've had Botox, fillers?
Well, actually, a lot of my patients say to me they've noticed such a huge difference, but no one said anything to them at home. And they said that's actually so great, because they want it to be subtle. They don't want anyone to have noticed. And they say with Botox, you can tell if someone's had Botox, if the injector's bad, when you can see that you can get like spocking, or
what is
like
spocking?
Very frozen. So your eyebrows will raise. And you'll get that sharp appearance to your eyes. Or when someone smiles, you get like flattening of the cheeks because there's too much Botox in the eyes.
Yes.
So yeah, the best when no one can tell.
Absolutely, for sure. And how long does it last? So if you would have Botox or filler, what is so you'd have it today, how long will it last for you?
So Botox usually lasts around 3 to 4 months. We usually say the higher the dose you have, the longer it lasts. But there are other factors affecting it, like one of them is vitamin C. So vitamin C is actually not great for Botox.
Oh, really?
But zinc is good for Botox. So we have a lot of patients because of COVID that are both on their vitamin C and zinc.
Yes.
And then your fillers last around 9 months to a year. So we usually ask the patient to come back every year just to top up their fillers. Yes.
And if you're coming in for a consult or a treatment, can you do it all at the same time, your Botox and your fillers, or should you stagger it?
Yes, so depending on how quickly you want results, you could do them every 2 weeks. You could do them all at once, but I usually suggest to my patients, let's go slowly, let's see the effect of the filler on the cheeks before we start addressing the jawline. Let's see the effect of the jawline before we start addressing the chin, just so that the patient's happy and they can see where they're going with the fillers.
Okay.
Yeah.
And I'm sure also if you're doing other treatments as well as your Botox and fillers, you have to do it at certain times. You can't, you've got to, because you're injecting, you don't want to do another treatment and then you move the product around. Is that correct?
Well, you can actually do most treatments on the same day as Botox. We just have to come and inject afterwards. Because as you said, if we do it beforehand, then the therapist can come in there. And we don't want Botox affecting the wrong muscle and then getting a side effect.
And is there home care afterwards? Like you shouldn't go to the gym, or you shouldn't lie on your face, or when you're sleeping?
Yeah, so for Botox it's quite strict. So we say no lying down for 4 hours don't exercise for 24 hours, and then don't do any facials, waxes, even hair appointments for the next 2 weeks.
Oh, really? Because that can affect, I suppose, any type of massage or stimulation on the skin can move the product.
You can still apply your home care products, but just gently.
Yes.
Yeah.
So I think let's get injecting and let's see the results. Wonderful. Thank you so much, Dr. Kate, for your time again today, and we look forward to seeing the finished result with Lianca.
Very excited to see final results. Yes.
Well, there you have it. It is so important to start earlier than later when it comes to looking after your skin and treating it. Skin Renewal is also a division of the Renewal Institute and is affiliated to Body Renewal, which specializes in body contouring, fat freezing, spider vein removal, laser hair removal, cellulite reduction, stretch mark removal, and other body-related treatments, as well as Health Renewal, which specializes in medical weight loss, nutraceuticals, IV infusion treatments, and the general improvement of the quality of life through healthy living. So as you can see, Skin Renewal is definitely the place to go for all your skin, body, and healthcare needs. Always remember, beauty is about being comfortable in your own skin. Have a fabulous, healthy week, and see you next week on Lianca's journey on a new you.
When it comes to your skin, call in the specialists. For a trusted, non-surgical solution to youthful skin, there is simply no better choice than Skin Renewal. Our clinics specialize in the full range of medical aesthetic treatments, using a wide range of medical-grade technology. Let our dream team of highly specialized doctors show you how to become the best version of yourself. Skin Renewal, the elixir of you.